If America spends $1.6 trillion of taxes on healthcare and doesn't have free healthcare, where does all that money go? Well, for one, a large number of Americans do have government healthcare, about 36%. That being said, as others have said, America sucks at controlling healthcare costs. The US has no desire to control costs. It's not profitable. My problem is the surgeons, doctors, and nurses who are out there working 24-hour shifts on their feet all day actually do the work. Those who have spent a fortune in schooling and have really used intelligence to get where they are and go out there every day and actually save lives and make a difference are getting paid less than a hospital administrator with barely a bachelor's degree in business. Don't forget pharmacists. They stand all day, perpetually short-staffed. BC corporate needs higher than record-breaking profits. They are dealing with the annoying-ass public that can't yell at the doctor for sending the wrong RX, so they yell at us there. I mean the pharmacists. BCE, they are the public's punching bag. Speaking for a friend. You should compare doctors and nurse pay in the US with other countries. It's way better in the US. They get paid a good wage. In other countries, the costs are controlled at a lot of places, including what is paid to doctors and nurses. The profit motive in anything is open to abuse of those who don't profit. Customers, patients, medical pros, etc. Hospital and pharmaceutical board members need to pay for their yachts. Sure, the issue is price gouging. Yeah, I don't think anyone complains if someone runs healthcare at like cost plus 10 to 15%, but we don't get that. We get cost plus 200 to 7,000%. The issue is there are still tons of games companies can play on what that cost is before the plus. This game happened with tons of industries during COVID-19. A company I worked for saw its costs for raw materials and other purchased components for building transmissions go up by about 30%, and our company had a cost-plus pricing model. So since our cost went up 30%, the plus we added on went up 30% as well. So because our suppliers charged us more, we had the highest net profit we had ever had on those products. Enforcing a cost-plus model encourages companies to artificially maximize their base cost. If they source from a more expensive supplier, they make more money. How messed up is that? Cost plus baseline percent is an interesting way to go. That's probably what should have happened when healthcare was redone in the last decade, but instead, they tried to handle it from the insurance side. A bunch of things should be handled this way, like the higher education system, but there's just too much lobbying and pocket lining to get it under control. An outstanding issue here is what's cost, and what are we willing to lose? An easy example is drugs, with R&D companies charging one drug 5,000%, and using the profits to conduct R&D on other drugs that are cost prohibitive. So if we charge cost plus X% for the first drug, that company will likely stop making or developing the cost prohibitive drug that some people may need. This already happens with some of the gov intervention in drug costs, and some of the big pharma companies often abandon drug R&D at high costs. We just typically hope smaller ones come and pick up the pieces. Also, how do we enforce it? Most people who argue about the cost of medicine, especially with regard to novel drug design and manufacture, have absolutely no idea the mountains of money that go into making a therapeutic agent. Further, the very obvious economic argument of, why would I invest in making a drug for a 10-plus year window with no returns when I could invest in literally any other vehicle, tends to go completely unanswered. As someone who works in the industry, there are two main pieces of advice I can give you if you're self-pay or have shit insurance. First, price shop whenever possible. I know you aren't doing it when you go to the ER, but for things like, say, an MRI, you can save a ton going to an imaging center instead of just taking the hospital referral. And that isn't as much price gouging, as we have to have a specific level of equipment to service a diverse demand. American Health Imaging just does imaging, might have that budget, older machine in the back that is good enough to get the image of your knee needed, not a high-resolution MRI we have to keep around for more specialized needs. Second, call the billing office when you get a bill and say, I can't afford that, and watch the bill magically drop 80%. We, as in healthcare, are stuck in this billing practice because insurers demand insane discounts and contracts. So we basically have to inflate the price on the invoice so we can turn around and give them some insane discount and still keep the lights on. You're getting that pre-discount price on the first invoice. Thanks for the insight. I'll try that on my current outstanding medical debt. A few weeks ago I was planning a colonoscopy and they pre-billed me for the procedure. My crappy insurance covered very little and I couldn't afford what wasn't covered. I called them and told them I couldn't afford it, so they canceled the colonoscopy. Or just don't pay it. I'm kidding. I worked with a guy who had to have emergency surgery and was in ICU for about a week and ran up a bill to the tune of about $300,000. He proudly said he just didn't pay it and never made an attempt to pay it, and he never heard anything from them, which I find hard to believe. I told him he's one of the reasons our freaking health insurance keeps going up. America sucks at controlling healthcare costs. It's because a lot of companies are created to milk the government in anything that is mandated. Healthcare providers from Medicaid and Medicare, and Department of Defense contractors, and education. For example, you don't need to be a doctor or a trained medical professional to recommend someone to get a knee brace or crutches etc. while getting their Medicaid/Medicare info to milk the government. A large portion of our GDP is created from the government buying $300 hammers, and then failing audits for 12 years in a row. Edit: Chuck Schumer got paid $1 million last year by a Jewish agency. More than his Congress salary. Will he be against the genocide? No. He gets paid not to care. Nikki Haley is on the board of Boeing that builds and sells ICBMs. Would she want to stop the war? No, because war is literally lining her pockets. It's hard to get people to care when they are paid not to. What about the fact that private health insurance companies are making huge amounts of profit for doing fuck all? Healthcare costs in the US have a lot of issues. And yes, if we went to a single insurer/payer system like a lot of other countries, we could cut some middleman costs there. Until then we are stuck with private insurance. But to claim private health insurance companies are making huge profits and don't do anything is incorrect on both claims. They, like your auto or home insurance, provide risk management for a fee. You transfer your risk to them and pay them to assume that risk. That is their business. They have stockholders that fund this and expect a return on investment. As much as some of us wish this was handled by, say, the government on a non-profit basis, the current reality is otherwise. As far as huge profits, all the major health insurers are publicly traded companies, and as such file their financials with the SEC in their annual 10-K filing. Their 10-K filings are available online. If you can read a P&L and balance sheet, have a look. There are no huge profits there in terms of typical ROI for publicly traded companies. Their actual margins are surprisingly small. That sounds like a biased view from one who is totally for the market and against the government. America spends twice as much on healthcare per capita than any other developed country. Yet on the scale of socialist/communist towards a free market capitalist, they are positioned towards free market the most of all these countries. All of Europe as well as Canada lean more towards socialist structures than the US and spend half as much on healthcare. And no, I'm not a commie who claims the free market capitalism is to blame. I think there must be other factors at work causing this situation for the US. Not sure where you got $1.6 trillion. It varies by year, but in 2019, according to the US government, it spent about $800 billion on Medicare, which is a program for older people that, from what I can tell, is pretty good, and covers you about as well as the NHS traditionally has, pre-Tories, or at least pre-COVID, just without owning the infrastructure. Then there's a further $600-ish billion on Medicaid, which is mostly for very poor people, and who that covers and what that covers varies a lot by state. If you're under 65, and not desperately poor, you're on your own. Obviously over 65s require drastically more money spent on them for health care in any society, so simply extending that to everyone would mean that non-elderly people wouldn't cost what over 65s do per person. Estimates I've seen on extending that to everyone would be about $3 to $4 trillion, meaning people would have to spend on taxes roughly what they would save on not paying for private insurance, just with absolutely everyone covered, and much more reliably. At the moment, if you can't afford private insurance, but aren't absurdly poor or 65 plus, you're just fucked. That 1.6 trillion number is incorrect. In 2021, the US spent over $4 trillion, 13K per person, which is 5K higher than the next closest country, Germany, where healthcare is a human right. We spend more than anyone else, to not cover everyone, to have worse healthcare outcomes than any other industrialized nation in the world. Most of the allocation of healthcare services is filtered through a layer of for-profit companies that are designed to deny, delay, and limit healthcare. And there is a prevalent belief that universal healthcare will be a scourge on society for two reasons. The government is inept and the uninsured are lazy and will be getting for something that the others earn through work. The uninsured don't receive preventative healthcare services and only seek healthcare when they have an emergency, further adding costs to the system. And then there are those who receive healthcare services and get into debt, often requiring bankruptcy through no fault of their own. It's a constant struggle in America. It forces people to make decisions about where to work, when to receive services, and how much services to receive. It's a system designed to limit access, which causes unneeded suffering and poor outcomes. Lots of snarky and sarcastic responses here, many of them incorrect. First, let's start with free healthcare. There's no such thing, regardless of where you live. Doctors, nurses, orderlies, janitors, and maintenance staff all have to be paid, and equipment and infrastructure have to be paid for and maintained. None of that is free. What you mean to say is taxpayer-subsidized healthcare. In the US, we do have taxpayer-subsidized healthcare for poor, disabled, and retired folks. It's called Medicaid and Medicare, and everyone who earns a salary pays into these funds. That's the $1.6 billion you are referring to, and it covers the healthcare costs of those particular groups, which total many millions of people. The rest of us, in addition to the Medicare and Medicaid taxes that we pay, also have to pay for our own health insurance. Educate yourself somewhere besides Reddit. The US system isn't great, and there are plenty of folks who fall through the cracks. Personally, I don't trust the government to effectively run a totally free healthcare system for the entire population, but I think our current system needs to be overhauled badly.